Okay, let's start. Let's start the transition. Okay, so today I'm going to talk about the bladder calculi. Okay, right. Now, around 5% of all the urinary tract stone disease are basically present inside the bladder. So inside the urinary system, urinary system, the stones can happen either in the kidney, they can happen in the ureter, or they can happen in the urinary bladder. So around 5% of all the urinary tract stone diseases, they occur basically inside the urinary bladder. So that is what you need to understand. Okay. Now, when we talk about the types of the bladder calculi, so they are basically of two types. They can be either primary or they can be secondary. What do you understand with the primary bladder calculi? Primary bladder calculi. Okay, so this is something which is very, very important for you to understand. At different places, there are different definitions of the primary and the secondary bladder calculi which are being given. Okay, so what is the primary bladder calculi? Primary bladder calculi is that calculi which happens in the absence of any underlying urinary tract pathology. Okay, so without any underlying urinary tract pathology, if at all there is a kind of a calculus which is basically present inside the bladder, that is what is called as a primary bladder calculi. Secondary is due to some underlying urinary tract pathology. For example, urethral stricture. For example, neurogenic bladder. For example, benign prostatic hyperplasia. Okay, so this is the basic difference between the primary and the secondary bladder calculi. Okay, primary is without any underlying kind of urinary tract pathology, and the secondary is due to some underlying urinary tract pathology. So that is the basic difference. Okay, now this difference is important. Okay, so this is many times asked in your table vivas. This is many times asked in your exams as well. Okay, so what is a primary? As I told you that this is happening in the absence of any particular urinary tract pathology. So this primary bladder calculi is something which is more common in the children. Okay, children in the developing world. Okay, so the primary bladder calculi is more common in the children in the developing world. That is what you need to understand. Okay, now this happens because of the nutritional deficiency. Okay, so let's say in the developing world, if at all the child is kind of growing up, and if at all there is some kind of nutritional deficiency like the vitamin A, B6, magnesium, phosphorus, the crux of this is that the protein to the carbohydrate ratio is less. So in other words, the protein is less in the food. Okay, if that is there, then the patients are predisposed to the primary bladder calculus. This primary bladder calculus, is it more common in the males or the female? Please understand, the primary bladder calculus is much more common in the males as compared to that of the females. Okay, so primary bladder calculi is much more common in the males as compared to that of the females. Okay, so primary bladder calculi, the one which is happening in the absence of any kind of a bladder or urinary tract pathology. That is the first thing. Second thing is that it has a nutritional deficiency like vitamin A, B6, magnesium, phosphorus, all those things. The protein to the carbohydrate ratio is less. Okay, so the protein content of that particular food is diet is less. Okay, this is much more common in the males as compared to that of the females. So primary bladder calculus is much more common in the males as compared to that of the females. Now, uh, this primary bladder calculus is predominantly of ammonium urate or calcium oxalate. Okay, so what is the constituent of this particular stone? It is ammonium urate or a calcium oxalate stone. Okay, that is what you need to understand. That is about the primary bladder calculus. Now, what about the secondary? Okay, now this primary bladder calculus is also referred to as an endemic calculus. Why it is called as an endemic calculus? Because let's say there are children in one particular area. All the children in that particular area will have like the dietary things of that particular patients will be lesser. Okay, so let's say if at all there's one particular village where the protein content of the diet is very less. So most of the, or let's say many of the male children of that particular area might suffer from the bladder calculus, and that is why it is called as a primary or an endemic bladder calculus. I hope you're able to understand this point. Okay, so that is what is called as a primary or an endemic bladder calculus. Now, what about the secondary bladder calculus? Secondary bladder calculus occurs in the presence of some urinary stasis. So, for example, there is some kind of a urinary pathology. For example, there is a urethral stricture or there is a benign prostatic hyperplasia. Okay, so what happens is because of this, there is a urinary stasis, and because of this particular urinary stasis, there is a formation of a calculus inside the bladder. Okay, so this is what is called as the secondary bladder calculus. This can happen in the, let's say, for if at all there is some kind of a foreign body inside the bladder, how this can happen. Occasionally, there can be something which is called as a like the tip of the catheter. Okay, that particular tip of the catheter can be retained inside the urinary bladder. It can lead to the secondary bladder calculus. Or let's say there is some infection inside the urinary bladder. So that can again act as a nidus, which can lead to the stone inside that particular urinary bladder. Or let's say there are for certain drugs. Okay, so for example, yeah, the drug stones, all those particular stuff are present in the secondary bladder calculus. Then uric acid and then the triple phosphate. So the secondary bladder calculus is predominantly consisting of the uric acid and the triple phosphate stones because they are happening in the presence of the urinary tract infection. I hope you are able to understand this point. Okay, so we have a primary and we have a secondary bladder calculus. Primary bladder calculus, children, developing world, diet which is deficient in the proteins. This is important. Okay, protein to carbohydrate ratio is a less and much more common in the males as compared to that of the females. The ratio is 10 is to 1. In the primary bladder calculus, male to the female ratio is 10 is to 1. Okay. Now, it is also called as an endemic because one particular area might get affected because of this primary bladder calculus. In the secondary, some kind of a urinary stasis. Okay. So, for example, BPH, urinary urethral stricture, all these particular things, some kind of foreign body. The most common one is that is the tip of the catheter is kind of retained there. Okay, so tip of the catheter can be retained inside the urinary bladder, then infection, then drugs, uric acid, triple phosphate, all those particular things are the secondary bladder calculus. Okay, so I hope you have understood. Now, let's move ahead. Now, okay, so urinary stasis, evaluate the residual kind of volume. So whenever you have any particular patient in whom there is some kind of urinary stasis, what you look for is a post-void residual volume. What do you understand by the post-void residual volume? It basically means that, let's say, if I am going to pass the urine, before passing the urine, my bladder has 400 ml of the urine. Now, after passing the urine, what is the amount of urine which is retained inside this particular urinary bladder? Okay, so let's say if I pass, let's say 300 ml and 100 ml is still retained inside the urinary bladder, the PVR or the post-void residue is basically 100. Are you understand my point? Okay, so there's a pre-void and there is a post-void. Pre-void is let's say 400, post-void is 100. So the post-void residual volume is 100. Okay, now let's say around 50 is kind of okay, but always it is considered as a ratio of the pre-void. Okay, but let's say if at all there is a bladder outlet obstruction. Okay, there is a significant BPH. In that particular scenario, what is going to happen? The post-void residual volume will be very high. It will be, let's say, 200, 300, 350 or something like that. Detrusor underactivity. What is going to happen? The detrusor underactivity, that the patients have lost their sense of contraction and the bladder has over a period of time got over distended and the urine has got accumulated over there and the urine is basically coming drop, 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 drop. Are you understanding? So this is what is called as a detrusor underactivity. Okay. Now, then there is something which is called as a bladder augmentation or the substitutes. Okay. So let's say if at all you have used ileum. Okay. So as a treatment of a muscle invasive bladder cancer, when you basically do what you call as a radical cystectomy, you can make a neobladder. Yes, we can make a neobladder. Now, this neobladder is made up of ileum. Now, this ileum doesn't have a contraction capacity, right? So, like in that particular scenario, the post-void residue can be more. Neurogenic loss of the like urinary tract dysfunction. Okay, so let's say if at all somebody has a spinal cord injury. In that particular thing, the patients will not have the sensations to pass urine and they will not be able to pass urine. So in all these scenarios, what can happen is that the urinary stasis can happen and this can lead to the urinary bladder stone. And this is what is constituting your secondary bladder calculus. I hope you have understood this particular point, guys. Okay. Now, foreign body, as I told you, that's some kind of one of the common is, let's say, indwelling catheter or the ureteric stent. Okay, so the catheter tip is kind of lost there, or let's say the balloon got bursted and few particles of the balloon were present inside the urinary bladder, or let's say some suture was non-absorbable suture was used and that basically retained inside the urinary bladder, which led to the formation of a stone or migrated intrauterine device or something like that. Okay, that's fine. It's very, very rare, but yeah, like all these things can happen. So this is what I mean by the foreign body. Now, obviously, infection can happen. Drugs, as I told you, indinavir, trimetrine, these are the drugs which can lead to the formation of a stone. So these are the drug-induced stones. Okay, indinavir, trimetrine, these are the drug-induced stones. Okay, right. Now, moving ahead. Okay, now what are the clinical features? Okay, what are the clinical features? The clinical features are terminal